Okay, hello, this is video 20, muscles of the thigh. So we have quite a few muscles to cover in this video. However, it's not so bad, I guess is what I want to say. It's not so bad because they are they group together. Basically, we're covering 3 different groups plus one muscle that isn't in a group. And so as we're learning these muscles, if we can think of them as a group, that helps to learn the actions and the attachments and all that. So the muscles we're talking about in this video are sartorius. We'll go through each one more individually, but just to put them all out there in the beginning, we're talking about sartorius. We're talking about the quadriceps femoris group, also known as the quads. So that's rectus femoris, vastus lateralis, vastus medialis, and then there's a deeper one called vastus intermedius. And we're looking at the hamstring group. So that includes biceps femoris, it includes semitendinosus, it includes semimembranosus. Those are the 3 hamstrings. And then the adductor group we're looking at. And the adductors are here. I don't know how well we can see them all with all of the muscles in place, but pectineus, adductor longus, gracilis. Back here we should be able to see adductor magnus, and there is also adductor brevis that we'll see when we take them all apart and look at the deeper layers. Okay, so those are the muscles in this video. So let's go ahead and dive in and get started and look at the muscles of the thigh. Okay, so let's actually start with sartorius, even though it's the last one on the handout. It's the most superficial, and we're looking at the superficial layer right here. So let's start with sartorius. Sartorius in your book is on page 510, and so let's look at attachments first of all. Sartorius attaches at the anterior superior iliac spine. So we just took a look at that in the last video. That is that easy to palpate. Let's see if we can see it. Kind of. Is that easy to palpate bump on the anterior aspect of the pelvis? It's prominent. It's also abbreviated the as-is or the ASIS. So the anterior superior iliac spine here, that is where sartorius originates, or that's its proximal attachment. And then its distal attachment is down here on the tibia. So sartorius crosses the hip and it crosses the knee. So we're going to see actions both at the hip and at the knee. And so its distal attachment is the pes anserine tendon at the proximal anterior-medial tibia. What does that mean? So first of all, the pes anserine tendon, we're going to come back to that at the end, but there are three muscles whose tendon tie into and create the pes anserine tendon here. Pes anserine means goose foot. So if you can imagine a goose's foot here, that's what that is supposed to look like. Like, you know, when a goose picks up her foot and then it's kind of pointed, that's, I guess, what that's supposed to look like. Pes anserine. Anyway, the pes anserine tendon attaches to the tibia. So here's the tibia. And it's on the medial aspect of the tibia. It's on the proximal aspect of the tibia, and slightly anterior. So that's where we get all of that nomenclature, is the proximal anterior-medial tibia. Okay, so one of the things we're going to see with the pes anserine tendon is that the 3 muscles that all tie into it are going to share actions there at the knee. And so that's going to help us to remember those actions of those 3 muscles that tie into it. So sartorius is just the first so far that we're looking at that is part of the pes anserine. Let's look at actions for sartorius. So like I said, it crosses the hip and it crosses the knee, so we're going to expect to see actions at both joints. It crosses the hip anteriorly, so that means it's going to be able to flex the hip. So sartorius is one of our hip flexors. It also abducts the thigh at the hip. So it takes the thigh out in this direction. It abducts the thigh at the hip. So basically, if we're thinking about moving this muscle, you know, I mean, it looks like these two attachments almost lined up with each other, but you know, a lot of the muscle is over here more. So if we think about moving this muscle over so that it is in alignment with this attachment, we're going to get movement in this direction. So it abducts the thigh. Oh, let me mention the name sartorius. The name sartorius means tailor's muscle. And so the actions that sartorius does are the actions that you would need to do to be able to sit with one leg crossed over the other, which is, I guess, how tailors sit according to anatomists, because that's what they named this muscle. Anyway, so hip flexion, hip abduction, hip lateral rotation. So if you think about sitting down with one leg crossed over the other, but not crossed at the knee, but crossed with the ankle at the knee, if you know what you know. So it's kind of like a figure four kind of shape with the way that the legs are. That gives you that hip flexion, that hip abduction, and the hip lateral rotation. And so those are the three actions at the hip that sartorius does. And then at the knee, sartorius flexes the knee, and then it immediately rotates the leg at the knee. So one of the things we need to remember about the knee is that when it is flexed, it can do medial and lateral rotation, but not when it's straight. When it's straight, it's locked in place so that it's not, you know, so that it's more stable when it's straight, assuming we're standing on it, or we might be standing on it when it's straight. So it does not do medial and lateral rotation in an extension position, but in a flexed position, the knee can do medial and lateral rotation. And so here, sartorius can pull the knee around and do knee medial rotation. Or pull the lower leg around for knee medial rotation. Okay, so those are the 5 actions of sartorius: hip flexion, hip abduction, lateral rotation of the hip, knee flexion, and knee medial rotation. Now, what we're going to see when we see all the rest of the pes and serine muscles is that they share those 2 knee actions. All 3 muscles that tie into the pes and serine tendon here, they all do flexion of the leg at the knee, in other words, knee flexion, and they also do medial knee rotation. So we're going to see those 2 shared actions in the pes and serine muscles. Okay, and then keep in mind that if a muscle does hip flexion from below, so that it attaches to the hip on the anterior aspect, and then it attaches somewhere down below there, and does hip flexion, that our reverse mover action for that is an anterior pelvic tilt. So remember that an anterior pelvic tilt is bringing the pelvis like this. So it's taking this attachment and moving it, you know, contracting the muscle and moving this upper attachment down toward the lower attachment. That's anterior pelvic tilt. So we're going to see a lot of that with the hip flexors that we're looking at here. Okay, so that's sartorius. Let's move on and look at the quads. So the quads, like the name implies, there are 4 muscles of that group. And I'm trying to find them in the book here. Let's see, what page are they on? 564. The 4 muscles of the quadriceps femoris group. So quadriceps femoris, quadriceps means 4 heads. So that means that there are 4 muscles in this group, and femoris refers to the thigh. So that's the name of the group, is the quadriceps femoris group. Let's take a look at rectus femoris, the most superficial of the quads. So rectus femoris, the name rectus femoris refers to that its fibers run straight up and down the thigh, the femur, and so it crosses the hip and it crosses the knee. It is the only one of the quads that crosses both the hip and the knee. So it's the only one that we're going to see hip and knee actions. All the other three quads only cross the knee and only have actions on the knee. So attachments for rectus femoris: anterior, inferior iliac spine. So can we see that attachment? Sure we can. Anterior, inferior iliac spine. So we can see here, that here is the anterior superior iliac spine. That's where we had sartorius attaching. And now below that, actually in two kind of separate places, we have we have rectus femoris attaching at the anterior inferior iliac spine. And actually that other little split that you can see there is attaching to the top of the acetabulum. It's a little bit hard to see, but you can kind of see that, right? So anterior inferior iliac spine is fine to know for the attachment, but that other attachment that you can see there is at the edge of the acetabulum. All right. Okay. So, and then the distal attachment for rectus femoris. So what we see here is I'm indicating the whole muscle. Let's look at this. So what we see here is the patellar ligament. The patellar ligament attaches to, let's fade it and see if we can see. Can't see it super well, but there's a landmark here on the tibia that we haven't gotten to yet because we haven't named all of those parts of the tibia yet. But there on the tibia, you can feel it easily on your own tibia, is the tibial tuberosity. So the patellar ligament attaches to the tibial tuberosity. The patellar ligament is a continuation of the tendon of the quads. And the tendon of the quads is what the patella is inside of. Oh, that's the prepatellar bursa that we're seeing there. If we get rid of connective tissue, there we can see the patella. So remember that the patella is a sesamoid bone. Sesamoid bones are inside tendons. The tendon that the patella is inside of is the tendon, that common tendon that's formed by all four quads. So above the patella, we're going to call that structure a tendon. It's this white part here, and that's it of rectus femoris, but all of the other quads all tie into that as well. So that's the tendon of the quads, or the quadriceps femoris tendon. And then if we add our connective tissue back on here, then we'll see the patellar ligament. So remember that ligament attaches bone to bone, whereas tendon attaches muscle to bone. So it's called the patellar ligament down below the patella because it's attaching bone to bone, in theory, that it's attaching the patella to the tibia, and specifically to the tibial tuberosity of the tibia. So all four quads have a common distal attachment, which is the tibial tuberosity of the tibia, which is a pretty prominent bump just distal to the knee on the tibia that you can feel. But they get there via the patellar ligament, and we call it a ligament because it's going from bone to bone. It's going from the patella to the tibia. But really, it's important to keep in mind that that's continuous tissue from the quadriceps tendon to that patellar ligament. That's all continuous tissue, but we're going to call it different things along the way there. But anyway, that's the common distal attachment of the quads. So actions for rectus femoris: at the hip, rectus femoris is going to flex the hip because it crosses the hip anteriorly, so it will flex the hip. And then remember that if a muscle flexes the hip by crossing it anteriorly and by attaching both to the pelvis and somewhere below it, it's also going to do an anterior pelvic tilt. So those are the hip actions of rectus femoris. And then the knee action for rectus femoris is that it extends the leg at the knee. So so I can't show that super well on here, but so let's say that the knee was bent. Okay, so so here's the joint here. Okay, so it was bent, and now we're going to straighten it. Straightening it is extending it. So knee extension is what the quads do. That's the common action for the quads. All 4 quads do it, and that is almost the only action you need to remember for the quads, because that's what they do. It's knee extension. Rectus femoris is the one exception, that it crosses the hip, and so it has hip actions, which are hip flexion and anterior pelvic tilt. Okay, so that's rectus femoris. Let's go deeper and look at more quads. So, oh look, we could have taken sartorius off all along. There's rectus femoris without sartorius over it. Okay. Okay, that's rectus femoris. Let's look at the next 3 quads. So let's start with vastus lateralis. So here's kind of the interesting thing about the next 2 quads that we're going to look at. Wait, do we want to do vastus lateralis next? What's in the book? Yes, it's vastus lateralis. Vastus lateralis means it's on the lateral aspect of where it is, and it's on the thigh, and it's vastus, so it's really big. It doesn't look super big here, but if we look on the side, we see that it's really big. And so it's so big, in fact, that if we, let's see, what do we want to fade here? Let's fade everything else and see if we can see its attachment. Vastus lateralis, you know, we think of the quads as the anterior thigh muscles, which is an appropriate way to think of them because that is where they are. But vastus lateralis very much exists on the lateral aspect of the thigh, so much so that its attachment is actually on the posterior thigh. So here we have this anterior thigh muscle that attaches on the posterior aspect of the femur. So attachments for vastus lateralis are the linea aspera of the femur. So remember the linea aspera, we won't be able to see it so well, but I don't think, oh yeah, you can see it on here. See that line right there? That line back there, and of course my pen is the same color as the bone, but that's the linea aspera. That's where vastus lateralis, an anterior thigh muscle, that's where it attaches, is on that posterior aspect of the femur. So it attaches to the linea aspera of the femur, the lateral lip of it specifically, and then what's its distal attachment? It's a quad. So its distal attachment is the tibial tuberosity of the patella and via the patella and the patellar ligament. So tibial tuberosity, that's our common distal attachment for the quads, and it gets there via the patellar ligament. Okay, so that's vastus lateralis. What action does vastus lateralis have? It is the one and only action that is shared by all of the quads, which is knee extension. So vastus lateralis only crosses the knee, and its action is to extend the knee. So that's vastus lateralis. Let's look at vastus medialis. Vastus medialis, again, is vast, which means it's big, and is on the medial aspect of the thigh, even though these are all anterior thigh muscles. So vastus medialis, like vastus lateralis, is really vast. Okay, it doesn't look so huge here, but anyway, but it is big enough that it is an anterior thigh muscle that attaches on the back of the thigh. I don't know if fading that muscle is the best way. No, let's fade others and see if we can see it attaching back here. Yeah, we can. So it attaches to the linea aspera again, but it's the medial lip of the linea aspera. So it's the posterior aspect of the thigh, but the medial lip of the linea aspera, whereas vastus lateralis attached to the lateral lip of the linea aspera. And then its distal attachment is, of course, the tibial tuberosity of the tibia, and it gets there via the patella and the patellar ligament. That's vastus, and then its action is knee extension, but we know that because it's a quad. Here's our 4th quadriceps femoris muscle. It's vastus intermedius. It's less vast than the other 2, but it's still vast enough to be one of the vastus sisters. So vastus intermedius means vast, it's big. It means that it's intermedius, means between the other 2. So it's between vastus lateralis and vastus medialis. So this one is a quad that actually, you know, like all the quads, it's an anterior thigh muscle. It actually attaches to the anterior thigh. It's the only one of the quads that attaches to the anterior thigh. So specifically, it's the anterior shaft and linea aspera of the femur. So it does wrap around enough on the lateral aspect to attach to the linea aspera over here. Nah, it doesn't look like it in the app, but that's what the book says. Okay, so that's vastus intermedius. What is its distal attachment? Well, of course, it's a quad. So its distal attachment is, why does that look like that? Oh my gosh, we can see right through the thing. It's glitching. Vastus intermedius, its distal attachment is the patellar ligament. Oh, maybe because I had it faded. It's the tibial tuberosity via the patellar ligament. That's its distal attachment. Its action, knee extension. Boom! Quads are easy, aren't they? So all 4 quads do knee extension. Vastus medialis and vastus lateralis, 2 of the quads attach at the linea aspera, but they all have their common distal attachment at the tibial tuberosity of the tibia. They all do knee extension. They are anterior thigh muscles. These three that we can see here, vastus medialis, vastus intermedius, and vastus lateralis, all only cross the knee and only do knee extension. And then our more superficial one, rectus femoris, crosses the hip, attaches to the anterior inferior iliac spine and to the acetabulum. For its proximal attachment, its distal attachment is the tibial tuberosity, and so it does knee extension with the rest of the quads. It also does hip flexion and anterior pelvic tilt since it crosses the hip anteriorly. Okay, that's the quads. Easy peasy. What's next? Hamstrings. Let's look at the hamstrings. So there are 3 muscles in the hamstring group. So hamstrings are posterior thigh muscles, and they share a common proximal attachment. So the quads were easy because they shared a common distal attachment. The hamstrings are easy because they share a common proximal attachment. And that common proximal attachment for the hamstrings is right here, is the ischial tuberosity of the ischium. So we'll see that coming up with the hamstrings. So let's look at the hamstrings. They are also very big, strong thigh muscles, but these guys are on the posterior aspect of the thigh, and being on the posterior aspect of the thigh, we're going to see that they're antagonistic to the quads, or antagonists to the quads, I should say. Okay, so first one is biceps femoris. So biceps, we've seen a muscle called biceps before. That was biceps brachii. So biceps brachii was a muscle with 2 heads to it that was in the upper arm. So biceps femoris is a muscle with 2 heads to it that is in the area of the femur. So biceps femoris. And what we're looking at here is the long head. I think we have to get rid of this one to see the short head. There's the short head. So the short head of biceps femoris is the only aspect of the hamstrings that does not cross the hip. The rest of the hamstrings, so the long head of biceps and semitendinosus and semimembranosus all cross the hip. The short head of biceps does not cross the hip. So let's look at attachments. So short head of biceps attaches to the linea aspera. We're going to see, so far we've seen vastus lateralis, vastus medialis, an aspect of vastus intermedius, and now biceps femoris, the short head of it, all attaching to the linea aspera. Believe me, we are so not done with muscles attaching to the linea aspera. It is the busiest place on the femur. Okay, so short head attaches to the linea aspera. Let's put our long head back up here. Long head of biceps femoris shares that common proximal attachment with the hamstrings, which is the ischial tuberosity of the ischium. This also attaches to the sacrotuberous ligament, if we can pull this down here. I'm not sure how well we can see that ligament. But anyway, the sacrotuberous ligament is a ligament that runs from the sacrum to the ischial tuberosity, so there's some attachment there too. So I guess that is the sacrotuberous ligament, but it sure on the app does not look like biceps femoris is attaching to it, but that's okay. We won't hold it against it. All right, biceps femoris long, well, let's look at actions of biceps femoris. So the hamstrings all cross the knee, and the hamstrings, except with the exception of the short head of biceps, all cross the hip posteriorly. So actions for the hamstrings, so for biceps femoris, we have flexion of the leg at the knee. So we're gonna see that common knee action in the hamstring. So flexion of the leg at the knee and extension of the thigh at the hip. So both of those actions we're gonna see throughout the hamstrings. Flexion of the leg at the knee and extension of the thigh at the hip. So flexion of the leg at the knee is taking the knee like this. That's knee flexion. And extension of the thigh at the hip, to imagine that one on here, we'd have to, so let's see here. So like if here's the hip in a flexed position, extension of the thigh at the hip is going to be moving it into the position that you see it here, into this standing anatomical position. Okay, so that's extension of the thigh at the hip. It also, let's see, I think that's all the actions I'm having you know on these guys, right? Study the first three standard mover actions and the reverse mover action. Okay, that's not true. So first three. So laterally rotates the leg at the knee. Oh yeah, that's important too. Laterally rotates the leg at the knee. So that means that if the knee was bent and could do medial and lateral rotation at the knee, that biceps femoris could laterally rotate the knee. So imagine that this knee is bent. If it was bent, it would laterally rotate, so rotate it around like that. Okay, so knee lateral rotation, because it's attaching, its distal attachment down here. Oh, I didn't mention that. Its distal attachment is the head of the fibula. Okay, so biceps femoris goes from the ischial tuberosity of the ischium to the head of the fibula. Biceps femoris is the more lateral of the three hamstrings. It being lateral, it is actually the only one that attaches to the head of the fibula. The other two attach to the tibia. Okay, so knee flexion, hip extension. That's what we see with the hamstrings. Knee flexion, hip extension. Those are the shared actions. And then biceps femoris attaching to the lateral aspect, in other words, to the head of the fibula. It also does knee lateral rotation. And then the hamstrings in doing hip extension, if the femur is fixed and they pull down on their attachment here, they're going to do a posterior pelvic tilt. So that's the other action of that's kind of it is the reverse mover action of the hip extension for these guys. So hip extension and then posterior pelvic tilt. Okay. That is biceps femoris. Let's look at semitendinosus. Semitendinosus means that it has a long, its distal tendon is long and tendinous, and it is true. Look how long that tendon is down there. So this whole long stretch of tendon here is kind of where semitendinosus gets its name. Semitendinosus is the more superficial of the two hamstrings that are on the medial aspect of the thigh. So this is semitendinosus. Here's semimembranosus, which is the deep one. So semimembranosus is wider, and you can see semimembranosus peeking out from either side of semitendinosus. Okay, so, but let's go back for now to semitendinosus. So semitendinosus attaches at the ischial tuberosity, because why? Because of course it does, because it's a hamstring, and they all attach there except for the short head of biceps. So ischial tuberosity of the ischium, and then its distal attachment is what? Well, it's down here. It's at the medial and proximal and somewhat anterior tibia. That sounds like Pezanserine. Yeah, look at that. pes serine. So, so its distal attachment is the proximal anterior-medial tibia, but it ties into and is part of the pes serine tendon. So it is the second of our pes serine. What was the first one? Do you remember? It was sartorius. Sartorius was the first pes serine tendon that we looked at, and now we're looking at semitendinosus. So actions for semitendinosus, let's get some of these superficial muscles off of here, are going to be hip extension. Why? Because of course it's a hamstring, and that's what they do, hip extension. If it does hip extension from below the hip, it also does posterior pelvic tilt, so that's easy enough to remember. Same exact actions as the other hamstrings. It's going to do knee flexion, again because it's a hamstring, and the hamstrings cross the knee posteriorly, and they all do knee flexion. And then what else does semitendinosus does? It also does knee medial rotation. And so remember with the pes serines, all three muscles that tie into the pes serine tendon do knee flexion and knee medial rotation. So that is true of semitendinosus. Okay, let's look, and there are other actions too, but that's a good dose of actions right there for semitendinosus. Let's look at semimembranosus. Let's fade other things so we could see it a little better here. So semimembranosus is attaching to the, you guessed it, ischial tuberosity of the ischium. That's its proximal attachment, and then its distal attachment is at the knee, and it is the posterior surface of the medial condyle of the tibia, which you can see that pretty well. We haven't named all the aspects of the tibia yet, but you can take a wild guess that we would call this aspect, so the posterior tibia has these two aspects to it here, and those are the condyles. So it attaches to the posterior surface of the medial condyle of the tibia. So that is semimembranosus. Actions for semimembranosus: flexion of the leg at the knee. That's no surprise because it's a hamstring. All three hamstrings flex the leg at the knee or do knee flexion. It extends the thigh at the hip. Again, not a surprise. All three hamstrings extend the thigh at the hip, which means they also posteriorly tilt the pelvis because they do that extension from below. So if the leg is fixed and they pull down on that ischial tuberosity, they're going to posteriorly tilt the pelvis, which is tucking the tailbone under. And it does also do knee medial rotation, like semitendinosus, because it's on the medial aspect of the knee at its distal attachment. Okay, so those are the hamstrings. Easy peasy. Let's move on to the adductors. The adductors, so again, let's put all of our muscles on so we have a little kind of reference there. The adductors, if we look at them from an anterior aspect, they are a little bit hidden. So we're going to take off sartorius, and we'll take off other muscles here. But adductors, where would adductors have to be if a muscle was called an adductor? And we know that they're muscles that move the hip. Well, they're going to adduct the hip, right? Which means they're going to move the thigh in this direction. So if the thigh was out like this and then we moved it in, that's adduction. So if it's going to move like that, the adductors have to be in this area, and that is where we find the adductors. So there are 5 muscles of this group, and again we find a lot of commonality between them. In the adductor group, there is only one muscle that crosses the knee and the hip. All the rest only cross the hip, which is like kind of the reverse of the quads. The quads all cross the knee except for one that crosses the hip. The adductors all cross the hip except for one that crosses the thigh. One that crosses the knee. All right, let's see. Let's go ahead and start with pectineus. So let's take these guys down here. Here is pectineus. So pectineus is pectineus. The name pectineus means comb. So apparently it looks like a comb. All right. So use your imagination. Yeah, I don't know. Oops, I didn't mean to indicate that. Okay, here's pectineus. Remember I mentioned that it attaches, that there is something on the pelvis that we're not going to worry too much about, called the pectineal line. It's right there. It's named for pectineus, and it's on the pubic bone. So pectineus goes from the pubic bone to the proximal posterior shaft of the femur. So if we flip the femur around, and if we fade other things, we can see it attaching there to the proximal posterior shaft of the femur, which is kind of a lot to remember, the proximal posterior shaft of the femur, but it's not so hard to remember when you think about it like this, that the adductors, almost all of them attach to, guess where? The linea aspera, which is, that's where everything in the thigh is attaching. And so pectineus would attach there if it was a little bit longer, but the official linea aspera doesn't start up as high as pectineus is. It starts a little bit lower. Well, and it's maybe pectineus is a little anterior to the linea aspera, but you could almost think of pectineus as attaching at the linea aspera, and then that helps to group it in with the rest of the adductors. So actions for pectineus: it flexes the thigh at the hip, which is maybe not the first action I should start with. Let me start with the first obvious action. These are adductors, and so what do? They adduct the hip. So all of the adductors adduct the hip, or adduct the thigh at the hip. So they're going to bring that thigh in toward midline. So they all do that. Most of them also flex the thigh at the hip. So they're anteriorly located enough here that they can flex the thigh at the hip. So it's going to take the thigh up like this. So adductors flex the hip, and although we're going to see one that also extends the hip, but they all flex the hip, they all adduct the hip. Pectineus also medially rotates the thigh at the hip, so it's going to be able to rotate the thigh around medially, and anterior pelvic tilt. So the anterior pelvic tilt is that reverse mover action of the flexion of the thigh. So we can flex the thigh if the thigh is the moving part, and we're fixed up here. If we're fixed down, here, and we move from up here, we're going to anteriorly tilt the pelvis. Okay, so that's pectineus, and that's pretty representative of the adductors. So let's move on and look at other adductors here. Next one we'll look at is adductor longus. Adductor longus also attaches to the pubis, so more to the body of the pubic bone there, you can kind of see, attaching to the body of the pubic bone, and then that's its proximal attachment. Its distal attachment is the linea aspera. That's a surprise, isn't it? The linea aspera of the femur. There it is, attaching to the linea aspera. Okay, so that's adductor longus. It's an adductor, so what does it do? It flexes the thigh. If we're looking at that same action as a reverse mover action, it anteriorly tilts the pelvis. So hip flexion, anterior pelvic tilt. Of course, it's an adductor, so it adducts the thigh, and it can also medially rotate. So, but that's not a super huge action that we need to worry about a lot. Mostly, I want you to know the adduction, which is in the name, so that's easy to remember, and the flexion. And then if it does the flexion, it also does the anterior pelvic tilt. Okay, that's adductor longus. Let's look at, I think the next one in the book is adductor. Oh no, the next one in the book is gracilis. Let's look at gracilis. Here's gracilis. So gracilis, the name gracilis means slender or graceful. It's a lovely, long, very long actually muscle. Look how long it is. It's not as long as sartorius. Sorry, the dog is barking. Sartorius is actually the longest muscle in the body. I didn't mention it when we were looking at sartorius. But anyway, here's gracilis, also quite long, but not as long as sartorius, but it's lovely and graceful, which is where it gets its name. Okay, I have dogs barking all over the place here. Okay, bear with me. Focus on my voice and not the dogs barking. Okay, gracilis. So where does it attach? It attaches to the pubis. So again, basically to the body of the pubis, but a little medial to the attachment of adductor longus. Gracilis is the one adductor that crosses both the hip and the knee. So its distal attachment is down beyond the knee. Ooh, look at its distal attachment. Look at, what's it shaped like? Well, we all know what a goose's foot is shaped like, so it's obvious. It's shaped like a goose's foot. So gracilis is our third pes anserine tendon. If we can add these other guys back on here. There we just added on semitendinosus. There. And now let's add on sartorius, and there we have all three here's sartorius. There we have all three pes anserine muscles. So those three muscles are the three muscles that tie into that tendon called pes anserine. Now, what do all three of those muscles do? Knee flexion and knee medial rotation. So that helps us to remember the actions of sartorius and gracilis and semitendinosus at the knee. They all do knee flexion and knee medial rotation. So let's go back to gracilis. So gracilis crosses the hip and crosses the knee. It's an adductor, so and it's a pes anserine. So that should tell us all of its actions. As an adductor, it does adduction of the hip and anterior pelvic tilt. As an adductor, it does hip flexion. As a pes anserine muscle, it does knee flexion and knee medial rotation. So even though it has a lot of actions, especially compared to some of the other adductors, we can, fit it into these other categories, and it's easy to remember what its actions are. So that is gracilis. All right, what's next? We have two other adductors to look at here. We have adductor brevis, which we're going to have to get rid of a lot of muscles to see brevis. Brevis is here. So adductor brevis, if we look at it from the front, we can barely see it peeking out from between pectineus and adductor longus. If we look at it, so it's posterior to those two. If we look at it from the back, we can see it more clearly. This is adductor brevis. So of course we have to have an adductor brevis, because why would we have called adductor longus if there wasn't something to compare it to? And this is what we're comparing it to, which is adductor brevis. So adductor brevis is, it also attaches to the pubic bone, which we can see there, like the rest of the adductors. It attaches then to the linea aspera. That's no surprise, but it's the more upper aspect of the linea aspera. And so, okay, considering that it attaches to the linea aspera, we could easily say then that pectineus just doesn't get around that far. And that's why it doesn't attach to the linea aspera. But adductor brevis most certainly does. So what else? Okay, actions for adductor brevis are going to be super easy. Why? Because it's an adductor and it only crosses the hip, and so it adducts the thigh at the hip. It does, it flexes the thigh at the hip, and it does anterior pelvic tilt. So those are the common actions for the adductors, for the most part. At least pectineus, adductor brevis, adductor longus, gracilis, those all share those common actions at the hip. Okay, that's it for adductor brevis. Let's look at adductor magnus. So like its name implies, adductor magnus is a big adductor. It is the biggest adductor. Look at the size of that guy. There's adductor magnus. It's so big that we need to have a hole in it. That's the hiatus here, or a gap in adductor magnus, through which the femoral artery and femoral nerve go through. Okay, so adductor magnus is the most posterior. It is the biggest, like its name implies, but it also is the most posterior of the adductors. It is so posterior that it is just barely anterior to who? To the hamstrings. Okay, there are the hamstrings. If we get rid of them, there's adductor magnus. So adductor magnus attaches more posterior on the pelvis than the rest of the adductors, and you can see here that it attaches, the anterior aspect of its attachment is on the inferior pubic ramus, but the rest of it is on the ischial ramus, so it's pretty posterior here compared to the rest of the adductors. So it being attaching to the ischial ramus, that can kind of help us to remember that its actions are a bit like the hamstrings in some ways because it's so posterior. So remember that the hamstrings have that common attachment at the ischial tuberosity. They're attaching here at the ischial tuberosity. The adductor magnus doesn't go that far back to the ischial tuberosity, but it is on the ischial ramus, so it's just anterior to the ischial tuberosity. So it's posterior enough, at least that aspect of it is posterior enough, that it can act like it's a hamstring. And so unlike the other adductors, adductor magnus can actually do extension of the thigh at the hip. So it can take the thigh posterior like the hamstrings can. So adductor magnus, but it's still an adductor. It still actually can do hip flexion too. So there's an anterior aspect of it that is anterior enough that it can do hip flexion, but there's a posterior aspect of it that is posterior enough that it can do hip extension. So it does both flexion and extension. So let's see. So it extends the thigh at the hip, which means it also does posterior pelvic tilt. It flexes the thigh at the hip, which means it also does anterior pelvic tilt. It's an adductor, and so it does adduction. So those are the actions of adductor magnus. It does not cross the knee, so there's no knee actions there. It's all actions on the thigh. So if we look at adductor magnus from an anterior view, we can barely see it. If this was our only view, we would not say, oh, this is by far the largest of the adductors. No way. You have to look at it from the back to see how big it is. And you have to take the hamstrings off also to see that, but there it is. So I don't think I mentioned attachments. It attaches to the pubis and the ischium, which I kind of mentioned, but not super specifically. So the pubis and the ischium, I did say actually more specifically that it's the inferior pubic ramus and the ischial ramus. And then its distal attachment is the linea aspera of the femur. So that's no surprise either, right? Because everything in the world is attaching to when in doubt on the femur, if you're wondering about attachments, when in doubt, it's probably the linea aspera. So you can see it attaching there to the linea aspera. Okay, so is that all of our muscles for this video? Let's see. So we talked about sartorius, the most superficial muscle of the anterior thigh. There's sartorius, and remember what else I mentioned? That it is the longest muscle of the body. We can kind of appreciate that if we see the whole thing there. It's called the Taylor's muscle because of its actions. So we talked about sartorius, we talked about the quads, rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. We talked about the hamstrings. The most lateral of the hamstrings is biceps femoris. This is its long head. This is its short head, much smaller than the long head. The long head is by far the bulkier of the two. That is biceps femoris. Then we have semitendinosus, which is kind of the skinnier of the two medial hamstrings. And then we have semimembranosus, which is wider, and it's wide enough that you can see it on either side of semitendinosus. So we talked about the three hamstrings. The three hamstrings all do hip extension and knee flexion and posterior pelvic tilt. The quads all do knee flexion, knee extension, and the one quad that crosses the hip does hip flexion. And then our other group we talked about here is the adductors. So we talked about pectineus, we talked about adductor longus, we talked about gracilis. Those are the three that are easier to view from the anterior aspect. We talked about adductor magnus, which we can't see very well unless we take off some other things. There's adductor magnus, and then adductor brevis was our other one. So those are the adductors. The adductors as a group flex the thigh, and do an anterior pelvic tilt. Like their name implies, they adduct the thigh. those are their shared actions. They all do that. Gracilis also crosses the knee, and so does knee flexion and knee medial rotation. And adductor magnus is very posterior, and so it also extends the thigh and does a posterior pelvic tilt. And then we also talked about the pes anserine tendon, which is made up of what three muscles? Sartorius, gracilis, and biceps. I'm sorry, and semitendinosus. Come back here, guy. Okay, so and those three share common actions at the knee, which is knee flexion and knee medial rotation. Alrighty, so that is it for the app portion of this video on the muscles of the thigh, and then we'll take a look at actions on a real live moving body. Okay, let's take a look at these actions that of the muscles that we looked at of the thigh in video 20. So let's start with sartorius. So remember that sartorius is called the Taylor's muscle. And so it's called Taylor's muscle so that we can remember the actions that it does, but also remember that sartorius is one of the pes anserine muscles. And so that will tell us all of its actions. So sartorius does hip flexion, hip abduction, or we could look at hip abduction like this, and hip lateral rotation. So, you know, separately that seems like kind of a random bit of things, but if we put them together, if we do hip flexion and lateral rotation and abduction together, that puts us in this position that a tailor would be sitting in to do her or his work. Okay, so that's the hip part of sartorius. The knee part of sartorius is knee flexion and knee medial rotation. So there's the knee medially rotating. So this is lateral knee rotation, medial knee rotation. So sartorius, hip flexion, hip abduction, hip lateral rotation, knee flexion, knee medial rotation. That's what sartorius does. The quads, remember rectus femoris is the only one that crosses the hip. So it does hip flexion, and it also does an anterior pelvic tilt, which looks like that. And then all the rest of the quads do knee extension. So remember though that knee extension, so if the lower part of the leg can move freely, then knee extension looks like this, like you're kicking a ball. If the lower part of the leg cannot move freely, then knee extension might look more like this, right? So the lower leg is fixed and we just are standing up, and that's knee extension. So the quads are doing that. So knee extension, which could look like this, knee extension that could look like this. Either way, that's knee extension. We would call this extension of the leg at the knee. We would call this extension of the thigh at the knee. Okay, so the quads all do knee extension. Remember, the quads all have the common distal attachment of the tibial tuberosity of the tibia. The hamstrings all do hip extension. Okay, so they go from here to here, but also here. So again, remember that hip extension is also this. So here the hips are flexed, here the hips are extended. So we can think of hip extension as going from here to here, or here to here. Any of that is hip extension, but all of that is hip extension when the leg is moving freely. If the leg is not moving freely, then hip extension looks like this. That's hip extension. So that's the hamstrings. Hip extension, as far as the knee goes, the hamstrings are going to do knee flexion. So the quads do knee extension, the hamstrings do knee flexion. So they are antagonists at the knee. Quads do knee extension, hamstrings do knee flexion. And then the hamstrings also either medially or laterally rotate the knee. So the two that are the two that are on the medial aspect, so semitendinosus and semimembranosus, medially rotate the knee. The one on the lateral aspect, biceps femoris, laterally rotates the knee. And then our adductors. So adductors as a group, what their name tells us is that they adduct the thigh. So if the thigh is out like this, they're going to pull it in. So adduction of the thigh. They also flex the thigh at the hip. And remember, flexion of the thigh at the hip from below. If the leg is fixed, then that's going to be an anterior pelvic tilt. So adduction, bringing the legs in, which is like, you know, in space walking around, it doesn't seem like, I mean, if we're out in the air, right, it doesn't seem like we do this that much. But for instance, swimming might be something where we would do a strong adduction action, and there are other things too. But anyway, adduction of the thigh at the hip, flexion of the thigh at the hip, anterior pelvic tilt. All the hamstrings, or all the adductors do that. Gracilis crosses the knee, is one of the pes anserines, and so it also does knee flexion, knee medial rotation. Adductor magnus is the most posterior of the adductors, and so like the hamstrings, it also does hip extension. It also does posterior pelvic tilt by pulling down on the ischium, posterior pelvic tilt. Okay, so that's it for the actions for the muscles of the thigh. So that's it for video 20. Our next video, we're looking at muscles of the pelvis. So we get into the glutes and the deep lateral rotators and the pelvic floor muscles. All right, so that's coming up next.